and welcome. My name's Laura. I'm one of the Women's Health Physios here at KTBL. Hello to all our Facebook community. So today we are talking about how to check for diastasis recti and what to do if you've got it. So first thing is, what do you call it? Diastasis, diastasis, DRAM, all of those things mean the same, and however you pronounce it, however you say it, I'm always not sure if I quite say it the same way each time either. It is all talking about the same thing. We're talking about the separation or the parting. Now actually I really want to choose my words carefully there, because people always say to me, my abs have parted, my abs have separated. That's not actually the case. I'm going to grab my piece of band and I'm going to show you what I mean. So the band here, if you imagine the band has these two, your tummy has these two bands of muscles down the front of the tummy. So we're talking about the six-pack muscles, the rectus abdominis, these kind of bands of muscles down the front. In pregnancy, those muscles get stretched, so they do get put on a stretch. But at the same time, those bands of muscles, they part. Now they don't split and they don't separate in most instances, but they part. Now what happens when they part is there's a thinning. So there's a thinning of the fascia between. So like in that band, when it gets pulled, it looks, you can see through it a little bit more, it looks a little bit thinner, and it feels different to that tighter band that was there previously. So that's why I'm careful to say it's a parting or a thinning, because there is still a fascial connection between those two bands of muscles in most cases. So my first thing is to you, if you get told or if you're aware that you've got diastasis, don't panic, okay? Don't panic. There's things and strategies that we will talk about here that can be done, and there's absolutely some help and support and some resources that can be really helpful. So we want to think about what's happened and why we and what we need to do to try and help promote and optimize that healing and recovery. So if that's what's happening, in most cases, so 100% of full-term pregnancies will have some parting of the trans abdominis muscles. Yeah, they it takes time for them to come back in, and time can be a healer in itself, but we can also help encourage that and try and promote that drawing back in of those muscles coming back into a pose and draw them back in together, and that can really help that process along as well. In not all cases it does fully come back in, but we can try and create good strategies and good technique, and not necessarily that would limit or prevent you doing certain things. It can then be more of a cosmetic issue if things aren't then fully recovered in that diastasis, and that can be something again that we can support and talk to you about the options, and there is options to consider. So I want you to try and think about the movements that you're doing and what is happening around your tummy as you do certain movements. So that is giving you a clue. It's giving you an indicator of maybe a mismatch of connection or strength in the muscles. So for example, if you have heard of the term doming, what does that mean? It means the tummy muscles or the tummy itself goes into like a peak, sometimes called Toblerone tummy, but that doming is a good word to kind of think about that tummy kind of going up more in the middle rather than staying level and flat. You might notice that on activities that are putting those tummy muscles at a greater effort. So it might be like when you're getting up out of bed, or when you're getting up out of the bath, because those are movements that you might find that you do kind of in that kind of sit up tight position, and they're putting that muscle on quite a challenge, quite an effort, and that can be when we then see that diastasis occur. And so again, don't panic, but we are trying to say, well, let's think, well, if that's happening and that's why that's happening, let's try and modify the way that you're moving to try and avoid that happening. Not that we can rule it out completely, and not that we're saying you'll never do a sit-up again. We're saying let's modify it until we can bring in the right strategies and bring in the right training and rehab to try and manage that load better and manage that mismatch of pressure that we're seeing, because it gives us that clue, and it gives us an idea of thinking, right, well, if we can reduce the instance of that happening while we rehab, then we've got we can then see kind of where we go from there. So think of it as a clue and an indicator of what's happening with the tummy, and that there's a bit of a mismatch of strength and connection. So the first thing we want to do is try and build in the connection. Now I'm going to get you to think about the activation of these tummy muscles. But before we do that, I'm going to do just a quick diastasis self-check so that you know how to check the tummy muscles yourself. So I've got plates just set up behind me here, so I'm not going to expose my tummy, because on the internet I won't put you through that, but I will do it over my clothing. But obviously if this was you at home, you would do this just onto your tummy and onto your skin itself. So I want you to find your tummy button, and then you're going to place your fingers. Now I'd start with a couple of fingers, and I've just laid those fingers then side on, and I'm going to lay those fingers just at my tummy button, and I'm just going to fully rest off. So I'm going to relax my tummy and just gently press in just at that tummy button. Then I'm just going to gently lift my chin off the bed and lift my head just into that little bit of a sit-up position, and I'm feeling what's going on at my tummy, and then I'm going to relax down. And what you might feel is almost like a pinching in of the fingers either side. Now you're going to do that then above the tummy button and do the same thing, and then relax back down, and you're going to do that again, then lower down just below the tummy button, and then relax back down. So I'm just going to come back up so that I can talk to you about that. Now, you might find that it felt like that pinching in on either side of the fingers, and that might have been, so you might need to add more fingers or take more fingers away to try and feel that pinching in and how many fingers fits. So really rough, but works quite well to gauge that by how many finger widths. So maybe 2 or 3 finger widths that fit between those bands of muscle. So you're feeling the space or the distance between you feeling those tighter bands of muscle where the thinner area is. And that might be 1, 2, 3, 4, 5, yeah, or depending on where you're at. I also want you to think of how deep those fingers press in. Does it feel quite soft centrally, or do you feel there's a bit of resistance? So thinking depth as well, that 3D element. You don't need to gauge that, but just get a bit of a feel and idea of that. But also we're thinking about what shape. So does it feel like it's the same above and at and below the tummy button? Is it like parallel? Or is it more like a little bit of a diamond shape where it comes in a little bit narrower at the top and the bottom, a little bit wider at tummy? So when you think about what that shape looks like, is it like a diamond, or is it more of an open triangle where it goes thin at the bottom but wide at the top? So have a think just what that is across your tummy, because we're thinking not just in one place. We are thinking of that full core from kind of below the rib cage down to the pelvis, and we're thinking 3D because that's where we want to get that the idea of depth. So that's where it's all kind of in that area. So again, that's an indicator, and that's how you would do a quick self-check. But what does that tell you? It gives you some indications of what's happening, gives you an indication of where you're at, and it may give you an indication of the need to start something and try and promote and optimize that rehab. So if there is a diastasis, if you're feeling that gap there, maybe 2, 3 finger widths, then I want you to then see if you can build a connection. So we're wanting to see if we can activate our deep abdominal muscles. These are muscles that are core. These are muscles that are corset muscles around our middle. So the core is made up of pelvic floor, our diaphragm, these corset muscles, which is our transabs coming wrapping around our body, as well as the spinal muscles as well at the back. Those corset of muscles. Now I want you to bring your fingers onto the bony bits at the front of your hips. Just 2 finger widths onto those bony bits, bring them in about 1 inch and then down about 1 inch. So just going to sit into that pelvic triangle a little bit. Relax your tummy fully off. You can do this in lying down, or you can do this in standing or in sitting. Take a nice relaxed breath in. On the breath out, see if you can draw in, like you're maybe just doing a belt, 1 more notch, and you're just gently drawing in that lower abdominal area slightly. And then relax that off. See what happens under your fingertips. See if you can feel that gentle drawing in of lower tummy on that exhale, and then relax it off. Can you feel a different tension or tone under the fingertips? That's a way to just check that you're getting a connection into your trans abs, and that's a really important foundational point to be able to build on when you do your core activation and core training. So using that trans abs, that sense of drawing in, will help work these stabilizing muscles, help those muscles draw and bring that in, which is all that we're trying to do. We're trying to help that drawing and stability come back and strength come back, rather than wanting to see that mismatch of pressure and management. So we're going to get you to think about using that as more of a preemptive movement. So yes, it's going to be part of your exercises, but can you do that activation and gentle drawing in before you get out of bed? Can you do it before you stand up from a chair? Can you do it before you lift your baby's car seat or move and lift your toddler? Using it as that preemptive core activation. A little bit like the knack, thinking pelvic floor, lower tummy together, drawing in and giving some stability and support around there before you do the more challenging movements. So that in itself is going to be helpful. Now, if that is hard to remember and it does take time and effort initially, you can help remind your body with that, with maybe some taping. So that's something we use in clinic. And also some light compression can help as well, just give that proprioceptive input. So maybe your high-waisted leggings, something comfortable but soft, that gives that little bit of compression. But again, light. So we're not talking, there's been techniques of kind of really almost kind of binding the belly, and that's not necessarily helpful, because that can impact the respiratory system and it can interfere with your normal respiratory patterns and breath, and it can actually not necessarily encourage the muscles to get more active. We want to train and use that commission alongside the activity in the rehab, so still being able to use the muscles. So they want them switch on, not switch off. Yeah, okay, so give it time, encourage that natural building of the connection, can really help, using that trans abs activation in preparation before movement and activity, and then gently building that up. So we're talking your slow, low impact Pilates type foundational exercises is a really good place to start if you've got diastasis. Foundational exercises where you're not getting and not seeing the doming, but we do need to get you to a tipping point, and I want you to think about a tipping point. So all these exercises that you don't see the doming in is your comfort zone. That's kind of the ones that you can be doing and strengthening and building connection and good at. But in clinic, I need to get people working. They need to get to a point where we're saying, right, well, what is your tipping point? Where are we then seeing that doming happening, and where are we then getting to in our rehab? And then we need to kind of then build, so we get to that point and we can back off, and then we can try and build that strength so that we can move and shift the goal. So finding the tipping point and then not going further than it. So for people in clinic, I will challenge them. I will get them doing things, plank preps and tabletop positions, and seeing where that tipping point is, and then seeing if we can then backward chain it and try and build and strengthen from there. And don't be fearful of using different positions, your plank positions, hands and knees, these different positions to check the connection. Your connection is going to feel different when you're laid on your back than it is when you're on hands and knees, for example. Yeah, so try different positions to connect with your core. And really, I want to really have that as your take note home message, that don't be fearful. And there's lots of really strong, confident, really fierce women out there that are really living life and reaching their goals, that have had diastasis and been in recovery, and maybe still have a degree of diastasis. But that doesn't necessarily stop them. If they have built good technique, good foundational strength, then they've been able to still meet and reach their goals. So there's some really amazing examples of that out there. And you do want to make sure you keep moving though. So don't let fear stop you from wanting to try and wanting to do and wanting to achieve, because keeping moving is going to help shift those goalposts. It's going to help you build from those kind of movements that you're able to do into the things that you want to do, into the things that are life and function. There's a great resource, and the one that I'd recommend is a lady called Grania Donnelly. She's one of the Women's Health Physios. She's based in Dublin. She co-founded the writing of the Return to Running Guidelines, and you can find her online under the handle Absolute Physio. and she has done research and work around diastasis and has some resource packs that you can look at, and resources that she has inputted to that are on her page or on her if you follow her on social media. But if you do feel that your diastasis is significant, if you feel it's giving you symptoms, if you're getting pain, if you're getting discomfort, if you're really not happy with how it looks and how you move forward, or you're unsure about some of those points that I've mentioned today, then you really you will benefit from an individualised and a bespoke exercise assessment, an individual programme, and that's something that we can look at with you here in our clinic. So do get in touch and book in for with one of us here for a women health assessment, and that would be the individual and the bespoke approach to see where you're at, where that tipping point is, what you want to be doing, and really make that individual to you. Hopefully that's given you some great little tips and take homes, and do check out that resource from Grania that I'll pop on the link as well. Take care folks, and we'll see you next time. Bye bye.